Our final guest is Dr. Linda Calhoun with Cape Fear Heart Associates. Well, welcome to our show today, Dr. Calhoun.
Why, thank you for having me, June.
It's a pleasure to have you here. I'm so excited to get started because I really am passionate about this topic. So, first of all, how long have you been in our area?
Well, I've been in Wilmington for about 22 years, but we've been coming down here to the Brunswick area for about 5 years.
Yeah. So you've been in Wilmington for 20 years?
22, yeah.
You don't even look old enough to be there 22 years.
Oh, I feel it.
So what brought you guys to Brunswick County? What brought the practice to Brunswick County?
Patients actually get phobic when they see the bridge and, get really panicky. So I think it was really to service our patients.
Great. Well, that's what we want to hear. I'm sure they appreciate that.
Right.
So tell me a little bit about your education and your background. Where did you go to school?
Well, I'm a Georgetown bred for college and med school, and then I came down to UNC Chapel Hill for my residency in internal medicine, and then I went up to Philadelphia at the University of Pennsylvania for my cardiology fellowship, and then realized that North Carolina is really where I belong.
Well, we're glad you're here for sure.
Thanks.
So let's talk a little bit about Cape Fear Heart Associates. Now, I know that's a pretty big group. Tell me about your group and your partners.
Well, currently we are 15 physicians and 8, we call them advanced care providers, nurse practitioners and PAs. And, we try to make sure we can cover all aspects. We have about 4 electrophysiologists. All of us do general cardiology. We have about 5 interventionalists, but we just consider ourselves a very well-rounded group.
Let's talk a little bit about the services that you provide at Cape Fear Heart. Now, I know you said you do interventional as well, so you do heart caths and things like that?
Yeah, actually, as you know, cardiology just covers all realms. It covers arrhythmia issues, it covers blockage issues, heart failure or pump issues. So we actually have lots of different testing, lots of different interventions that we can do for patients that have all types of heart disease.
Okay, well, the reason I've asked you here today is because it's February and it's Heart Health Month. And so we specifically wanted to talk to you about women's heart health. So I guess I start very basic, like what causes cardiovascular disease in women?
Well, I think it's easier for me to kind of focus on coronary artery disease or arterial vascular disease. And we're talking about heart attacks and strokes, basically. But, this is a process that is a result of multiple risk factors. People that smoke and have diabetes, hypertension, family history, people that are overweight and don't exercise, people that are all stressed out. These are the types of risk factors that can lead to coronary heart disease.
And whether it be women or men, it can lead to...
I mean, it's interesting because if you look at, women are so scared of breast cancer and cancers in general, but if you look at coronary artery disease, it may take the lives of half of our women, and it's the number of deaths from cardiovascular disease far outnumbers the number of deaths from cancer and all sorts of cancer.
Well, from a layperson's perspective, what would be the difference between heart disease, heart attack, and heart failure?
Well, it's just that heart disease is just generic. As you know, I was just telling you, you can have heart failure, you can have heart rhythm problems, and then you can have heart attacks and ischemic heart disease. These are the types of things that lead to medications for angina, to stenting for acute heart attacks or for unstable syndromes or for known blockages, as well as for bypass surgery. So basically, heart disease is nonspecific, and coronary heart disease is encompassed in that.
Well, what would be some of the warning signs or symptoms of heart disease?
Well, I think that we all know about the grasping Levine sign, which is chest pain. I think most of us are familiar, but women may actually present more atypically. Women have more diabetes. Women are also very stoic because they've had children. They really know what pain's like.
What pain
so,
is.
but sometimes women may present with severe indigestion. That's 25% of the cases. Severe shortness of breath, exercise limitation, and fatigue. I actually had one woman that came in. She'd just been tired all weekend, and we ended up getting an EKG, and we found that she had a heart attack over the weekend.
Wow.
Tooth pain, neck pain, shoulder pain. So there's various types, but I think that if it comes with exertion, wakes you from sleep, is associated with shortness of breath and weakness, you need to be investigated urgently.
Yeah, I think some of those things we would just write off as, being nothing.
And
being
I
a
think
woman.
what's really concerning to me is that women present hours later than men. And that they're so reluctant to get urgent care. And so if you really think you're having a heart attack, you want to call 911. You don't want to just try to make an appointment or drive yourself to the hospital. You want to be urgently taken care of, because time is muscle if you're having a heart attack.
Can women's heart disease be hereditary?
Well, oftentimes it is, and it's interesting because one of the biggest scores that they use, the Framingham risk factor, actually doesn't take into account family history, but I actually follow families, and it's amazing to me how many children, mother or father, how many people are related to one another, because it's so hereditary. But not everyone has to have a family member that's had. They could be the first in their line.
It has to start somewhere, right?
That's right. And so just because you don't have a family history does not, exempt you from having it.
Well, and we talked about the symptoms in women. The symptoms in men, would they be similar, or are
they can be similar? It's just that women may present more atypically. But what is really worrisome to me is that not only do they have more atypical symptoms like shortness of breath and weakness and indigestion, but women oftentimes may present with sudden death as their first presentation.
Wow.
They can actually die in the field before they even get investigated.
That's scary.
That's right. But women and men have similar symptoms, but women have more atypical symptoms.
Like that jaw or the
tooth pain. I had a lady that actually she had all these teeth taken out, TMJ surgery, and she got an angioplasty, and it turns out her pain went away. So,
wow. Well, that's really interesting. Talk to me about how estrogen might help us. Do your estrogen levels protect you?
Natural estrogen levels protect women throughout life unless they start smoking. Then when they have diabetes or smoking, the estrogen levels do not protect them from getting premature or early onset coronary disease. But we think that estrogens may have a protective effect as long as a person doesn't have coronary artery disease. There was actually a nice study, done back in the 1990s, where they actually looked at giving estrogen to women, estrogen and progesterone in women that still had their uterus, and they actually found that it was detrimental in those with coronary heart disease. So we don't actually recommend, we actually stop estrogen replacement therapy initially when patients are diagnosed with coronary artery disease. We have to weigh the risk-benefit ratio of resuming estrogen therapy.
Oh, that was going to be my question. So if it could be of benefit, why don't we just...
But actually it was well studied, and it was initially thought it was beneficial, but when they did the prospective study and actually gave patients estrogen alone may be protective if there's not severe coronary disease. However, just talking to many women that are started on estrogen therapy and getting the right dose, it's so stressful. Actually, some patients actually get unstable with that. But estrogen and progesterone is actually a detrimental situation for patients. It increases their risk for more coronary events if they take estrogen and progesterone therapy and if they have coronary disease.
Wow, that's good to know. That's very interesting. Well, let's talk about diet a little bit. I'm sure the diet contributes to heart disease.
Well, we all know that your proximity to a McDonald's, Hardee's, Burger King, those sorts of fast food places, actually there's a greater risk for having coronary heart disease. So minimizing the pork and red meat, and here I'm saying pork in North Carolina, in the diet is really important. Trying to minimize fried food, sweets, which have both sugar, fat, and cholesterol associated with it. Definitely trying to eat less processed food, because we know the amount of salt you take in also can affect your risk of having hypertension.
We're getting close to being out of time, so I want to ask you this. If there was one message that we need to get out there to women about heart disease, what would that message be?
I think it's really important to know that most of the risk factors that lead to coronary heart disease are silent. So it's very important that women are screened for hypertension, high cholesterol, and diabetes, because these are silent risk factors. And that women take care of themselves as well as they do other people. Women are great at being caretakers and not taking care of themselves. So if we could just get women to be more aware that they are at risk, and then to take care of themselves and to address risk factors if they're present.
I think we think of that as a men's disease sometimes, and it doesn't affect us women. And
actually,
so
it's the number one killer of women. Number one killer of women.
And, you know, I bet that a lot of people don't know that. A lot of people don't know that. And so I think it's important that folks get a good primary care physician to be sort of their chairman of their health care. And watch out for all these silent things.
That's right, and actually screening, if appropriate. If you're going to do a 50,000-mile checkup on your car, you might as well do it in your body. And I think stress testing actually can screen for silent disease. Even I know there's a lot of different ways to screen, but definitely women need to be screened.
Screening is most important.
Yes.
Well, thank you so much for being here today. I know that February is a very important month for you and your group, and you're very passionate about women's health. So
only because I'm a woman, so.
And I too. So thank you so much for being here. It was a pleasure.
All right, thank you, June.
You're welcome.